Good evening, and thank you once again for joining me on this very informative episode of Gyneplus on Afia TV. My name is Doris Mayum Shishe. It's such a wonderful moment. Like, you can see the smiles all over my face because, it's a time where you get to learn, relearn, and unlearn certain things you never knew about what we're going to talk about today. And this is where we discuss health issues, basically around issues that affect women, girls, and children. And today we're talking about something that a number of us have probably is a word that we are very much comfortable with. We use it all the time, maybe not all the time, but you've heard people say this person is autistic, this person has autism. Sometimes we just throw out this word without really knowing what this is about. So today on the show, you're going to learn about what autism really is and what is not, what makes up that word, and everything that concerns that word. Maybe it's not a disease, by the way, but you get to learn more about it. So after the break, you will meet my guest. Please stay tuned. Welcome back. If you just tuned in, this is Gyneplus on Afia TV, and this is a show that primarily talks about health issues that affect women and girls, and then children in this society. And we get to bring experts and medical professionals in the field to tackle some of these issues and, of course, enlighten us. This show comes up every Wednesday at 6 p.m. and there's always a repeat broadcast on Saturday at 8 p.m. And today I'm being joined by a very beautiful lady, someone who is an expert in this field. She'll be talking to us about autism and all that we need to know. I'm very much eager to learn about this particular topic because, there's a lot of information out there. Ladies and gentlemen, I'm talking about Dr. Ngozi Onu, who is a pediatric neurologist at the Enugu State University Teaching Hospital. It's good to have you, Dr. Onu. Welcome.
Thank you, Doris. Yes. Good to be here.
Yes, I did mention earlier, yes, your voice you have an amazing voice. Do you sing?
No, I don't.
It's just you, hospital, theater.
No, I can't even sing to save my life.
No, but you have an amazing voice.
Thank you.
Thank you for joining me on Gyneplus today.
Thank you, Doris.
Yes, today I like you to talk to us about autism. But like I said before, in this part of the world, I'm equally guilty. We use the word as though it's something that is as common as it is. But before we get to understand what really makes up autism, what it means, just give us a brief rundown. The word autism, what is it about?
Okay, the word autism, or rightly put, Autism Spectrum Disorder, is actually the correct term because it's not a singular entity. It's a whole wide variation of issues that make up that entity. Okay, so it's a condition that affects the development of a child, okay, especially in the areas of communication, that is in terms of speaking, using other nonverbal means of communicating, in the area of social interaction, the way the child shares his interests with other people, and also in the way of behavior and interest. The child's behavior may be not the typical one we expect for a child that age, okay, and the child may have some restricted interests, maybe fixated on some things. So that is what autism is.
Okay. Now you said it's not one thing that is more like it's not something that makes up. It's a spectrum from what is spectrum. Now, is this something that a child is normally born? Because first of all, it's not a disease, right?
No, it's not a disease. It's just a disorder. It's a difference in the way the brain is wired.
Okay. Okay. So it's a disorder. It's more like there's an anomaly.
Yes. There's just a difference. We don't want to call it an anomaly.
Okay.
There's a disorder, a difference, but not necessarily a disease entity.
Okay, it's not something that needs a cure because that's why.
No, it doesn't need a cure.
So, but then again, how does it all happen? Is this something a child is born with? Just put it like at this place we want to hear from the very lamest point.
Actually, what a child is born with is not something that develops over time. Okay, it's something a child that is born with. But when the child is born, it's difficult to know that this child is autistic, because the child doesn't have, a child who is just born today is not yet developed. So as the child develops, the futures come up. But a child is born with it, usually from the genes, is usually some issues with the genes, okay, some issues during pregnancy or complications around the birth could make a child to be autistic. So it's something a child is born with, but does not manifest at birth, manifests as the child develops.
Okay. So, but then again, people have always, just like I said before in the intro, it's something that is a word that flies around. You can just see a child who is probably too silent or being overly reactive, we just say, autism, you can get like it's common. So what is it what are the signs that you are, a professional in this field, and let's say I bring my child to you, I feel like I don't like the way they are behaving, for instance. What signs do I have to look out for that will make me worry that, oh, this might be autistic at some point, that I need to see a doctor for, some kind of management? Just talk to us about these signs, things to look out for, and when should parents begin to worry? Could it just be a normal growing up pattern, or when should I worry as a parent?
Okay, thank you, Doris. Okay, so for the signs a parent or a caregiver or even a teacher can actually look out for, okay, as I mentioned earlier, that autism affects development in 3 domains: communication, social interaction, and behavior and interest. Okay, in terms of communication, okay, a child doesn't really talk immediately the child is born. Around 3 months, the child starts cooing. That is making the, that is what the child does around 3 months. As at 6 months, the child starts babbling, baba, baba, mama, tata. Okay, around 9 months, the babbling increases, ta 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 ta, da 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 da. Okay, at 12 months, the child may have a word, one single word. Some have up to 5. Okay, so if your child, okay, the same child around 2-3 months has what we call social smile. Social smile is not the smile where the facial muscles just discharges and they say the baby is smiling. No, social smile is, I see you, mama, I recognize you, mama, you're smiling, I'm smiling back at you. The mother smiles, the child recognizes this is my mom or this is somebody I know, and smiles back or looks back, acknowledges that look. A child with autism around 3 months may actually not be able to smile back. Okay, the mother is smiling at the child. It just looks as if the child is looking right through the mother.
That's at 3 months?
Yes, at 3 months. Oh. It looks as if the child is looking through the mother. At 9 months, the child with autism may not be babbling. Some normal neurotypical children may actually not have that eye contact or social smile at 3 months. Okay, but when we see that, we begin to worry and ask and put the child on the timeline. Okay, we need to monitor this child further. Okay, then at 9-12 months, okay, when the child starts babbling and having warm words, the child communicates not just with the words, but with the eyes. Like a typical 9-month-old child sees a stranger or sees something fun, maybe an airplane in the sky. The child is going to go look at the airplane and look at the mom. Like, mom, can you see the airplane? Looks back at the mom. A child with autism may see the aeroplane, just visit on the aeroplane, doesn't really look back at whoever is carrying him or her to check, do you see what I'm seeing? Does not share the interest with the person that is carrying the child. Okay, then the child with autism at that age, around 9 months, when you call a child, the child should actually understand the child's name. I call you Emmanuel. Emmanuel should know that my name is Emmanuel at 9 months. Okay, and should turn. But a child with autism most times do not respond to their names, even up to 12 months. You call and you wonder, do they hear me or don't they hear me?
But they actually hear.
They actually hear. Most times they actually hear.
Oh.
Okay, because if the child doesn't hear, yes, the child will have some issues with communication, but that's not autism.
Okay.
Okay, so these are some of the early signs. Then we cannot make diagnosis of autism at that age. It's usually too young, too early, because some neurotypical children also exhibit the signs. Okay, usually around 18 months, we expect a child to turn when you call the child. The child is not talking, is not turning. We expect the child to have some words, at least 5 words, 5 to 50 on the average. We expect the child to at least have 5 words. Mommy, daddy, the caregiver's name, water, just common things in the household. The child has no single word. At 18 months, we begin to worry. We expect a child of 18 months, when the child sees his peers or her peers, to go towards them, even if he doesn't say anything to them, but acknowledges that, oh, you're my mate. Okay, but a child with autism is not really interested in his peers. Okay, he seems to be in a world of his own. Okay, a child at 18 months may play with his peers, not really playing together, may just play side by side with his peer. The child with autism may come there, not interested in them, may just be interested in the toy they are playing with, pick it up and goes to play in another corner.
Okay.
Okay, so when after 18 months your child is not talking, or your child was trying to talk around 12 months and then suddenly stopped talking, the child is not using gestures to communicate with you, pointing, shaking the head, no, 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 nodding, okay? The child is not using the eye to communicate with you. Mom, see, do you see what I'm seeing? Okay, the child is just there. The child has some stereotypic behaviors, tend to like repetitions. Instead of playing with the toy, maybe a toy race car, okay, around 2 years, 18 months to 2 years, children can pretend with a race car that this car is actually moving. So you see them, voo, voo. But this child with autism may, instead of playing pretend with that race car, would decide to line up the race cars. Just want the race cars to be lined up. Okay, this child with autism may prefer to wear this particular clothes. I don't want a change in my routine. I just want it this way.
Wow.
If I'm having cereals every morning, please don't bring bread and tea. I'm going to throw a fit. I'm going to throw a tantrum. Okay, so when you see this child having some stereotypic behaviors, okay, or repetitive behaviors, or some funny movements, flapping the hands, some funny hand movements, just repeating or just running around in circles, okay, with the challenge, communication challenge, the challenge with interaction, not sharing interest with others, we tend to worry this child could be autistic. And for any parent out there, if your instinct tells you something is wrong, you're probably right. It's better you have the child assessed and we tell you, oh, this is still part of normal development, let's give this child some time. Then you say, oh, this child is going to outgrow it, and then you delay seeking intervention for that child.
Okay. I mean, thank you for that, broad, giving us a very broad understanding to what it is, because it's a lot of us would normally think the other way around. But one question, just to be sure, while you were explaining all of what it might be within the milestones and not speak, does it really mean a child with autism might decide not to speak, not because they are mute, but because they don't want to talk? Is that the case?
It's not in their power, not that they don't want to talk.
But they can't speak. That's what I need to know.
They don't communicate. Some of them actually speak.
But they're not mute, like born mute.
No, they are not mute.
Okay.
They are not mute.
It's just because they don't want to talk at that point.
Not that they don't want to talk. Just that their brain is not wired to communicate the way the neurotypical brain is wired to communicate. They are not mute. Mutism is a different entity, which is why when a child with autism comes for assessment, we have to make sure that the child is hearing first. Okay, we have to make sure that the child is not deaf. We send them for a hearing assessment. Okay, ensure the child is not deaf, because a child who is deaf is not going to be able to speak and communicate. Okay, and it's not just about the speech. There are non-verbal ways of communication. The child who is deaf will use sign language, gesticulate and communicate with you. But the child with autism communicates just to make a request. If they want to communicate, just to make a request. But they don't communicate to share their interest with you. A typical child will communicate to make a request and also to share interest.
All right. Thank you so much. At this point, because I like this discussion to really continue, Doctor. You're doing a great job, really. For me, it's opening my mind and eyes to a lot of things. And to you watching, I'm sure if you've been using the word autism, you've learned that the right word is Autism Spectrum Disorder. That's the right word. So, I mean, that has been noted. And other things that make all of this thing happen is not something that is... It's voluntary. It's not something the child would just say, because I've heard oftentimes people would say it's bad parenting because they pampered the child. That's why you see them fighting in public. But then again, we'll take a break, and once we are back, my guest will address these concerns. Please stay tuned. Thank you for staying tuned. If you just joined us, you're watching Gyna Plus on Afia TV, and we're having an interesting conversation bordering on autism spectrum disorder. I mean, I got that word. I'm not going to leave it. And I still have Dr. Ngozi Onu in the studio. You're doing a great job, like I said before.
Thank you.
And I'd like you to just, before the break, I mentioned something that oftentimes when we see tantrums like this, sometimes in public, we see an older child, let's say 14, maybe 15, fighting their parent in public. Sometimes with this advent of social media, I see some parents try to put it on, on the net, see how they're trying to cope with. Maybe that might be autism at some point, but we will explain a lot of things that might mean it could not be autism, so as the case may be. But the point I'm trying to make is oftentimes we've seen these children, being videoed and, posted online, and people would comment and say stuff like, you over-pampering that, just slap them, it's bad parenting. That's why they don't understand what this really is. Is it actually a bad parenting thing? Is there a thing that a parent should have done for real to have probably helped the child become more responsive, so to speak?
Okay, if a child really has autism, okay, there are a whole lot of things people throw around as autism. But a child with autism, a child with ASD, has nothing to do with the parenting, whether good or bad parenting. However, there are some things that look like autism that could be as a result of parenting. Okay, remember I said challenges with communication, social interaction, and then behavior and interest. Okay, some bad parental decisions could manifest as issues with behavior. Okay, but that is not autism. Autism has nothing to do with bad parenting. The common one that people mistake as autism is what informally is known as screen autism, okay, or rightly known as screen-related delays, okay, where a child has challenges in the 3 domains I mentioned: communication, social interaction, behavior, and interest. Yeah. But the child is not truly autistic. Okay, just that this child has been exposed to so many hours per day on the screen, television, laptop, tablet. The child is just fixated on watching all those things. So the time the child is supposed to use to learn how to communicate, learn how to speak, the child doesn't really learn it because the child is on the screen. Okay, the child doesn't learn how to interact because we learn interaction. Nobody is born interacting. You learn how to interact based on what you watch in the family where you grew up, based on your culture. We interact, the way we interact in this part of the world is not the way they interact in the western part of the world. So it's something that is learned. Even behavior is something that you learn. So when a child is spending so much time on the screen, the child doesn't really learn things in these domains. So the child may behave like somebody who has autism. And it's actually very difficult clinically to differentiate this child from a child with autism. Okay, so the key difference in the two of them is that when you do away with the screen and start engaging the child with screen-related delays, okay, when the parent starts engaging that child, do away with the screen, the symptoms tend to resolve. The child becomes neurotypical. Okay, but for a child with autism, even when you do away with the screen, without some specialized interventions, the symptoms are going to remain. Okay, so we see those people, it's difficult clinically to say, is this autism, is it not autism? Okay, the only way to know is doing away with the screen and seeing whether these symptoms are going to resolve.
Okay, I mean, thank you so much. You've given us quite more like a holistic view to this thing. But then again, if, for instance, a child is brought to you, you've assessed the child and you've confirmed for real that this is autism, what is expected of the parent to do? Like, they get back home, is there some sort of management plan? Is there something they're meant to do? And do they improve over time, really?
Thank you. With early intervention, children with autism get to acquire those developments that they don't really have in those domains I'm talking about. With early intervention, by early intervention, I mean starting applied behavioral analysis on time. Okay, this whole applied behavioral analysis is using positive reinforcement to get a child to do what you want the child to do.
More like pamper the child?
Not pamper the child.
Okay, the example of positive reinforcement in this case would be
positive reinforcement, okay. The child drags you, because children with autism, they will not point at the water, they just drag you to where the water is. Okay, they will just stop there, maybe start crying. You give the child the water. Oh, I know you need water. Give the child the water. You tell the child, say water, water, or cup. So with time, you don't just go immediately, the child asks you to give water. You wait some time. So the day the child says, ata, okay, you're going to show the excitement. I see you, I hear you, I see that you made effort. and you're going to give the child the water. Okay, so that child associates saying ata with mommy or daddy being happy and giving me the water. So the child is more likely to say the water again
Next
for
time,
you the next time. Okay, because this child had a behavior and there was a reward immediately. Okay, so that doesn't mean you should pamper the child. No, the day the child does the one that is right, you're going out. Remember I said they don't use gestures a lot, and the child waves bye-bye. You're going to wave back bye-bye, and you're going to show excitement. Okay, maybe give the child a hug. I see you, you're able to wave bye-bye at me today. I see you. So the child, every child, even the autistic child, okay, wants the parent to be happy.
All right. Thank you. I don't know how much time we have left, but I know that we'll be rounding up really soon, and I'd like this discussion to continue. And I'm glad that in the second part of the discussion, we'll be talking about, developmental delays in children. But before we even, round up this conversation, there are myths, some sort of misconceptions around, autism. Sometimes they tell you it's because the mother, while she was pregnant with the child, didn't take the supplement, the routine, medications. That's why the baby was, born the way they're born. Or sometimes they tell you it's a spiritual attack. And oftentimes they tell you it's because parents over-pampered the children, which of course you've already addressed that. But then again, what really, you mentioned earlier that it could be complications during birth or maybe the environment. You earlier stated that, but then again, I'd like you to just debunk this myth and put the facts out there in terms of, mothers not taking their routine medication while they're pregnant, or spiritual issues, or babies, children being, over-pampered, which is why they grow up to be, will I say, recalcitrant, if that's the word.
Children with autism, let me just correct you a little, are not recalcitrant. Okay. Bad behavior is bad behavior. It's not autism. Okay. So coming to the myth, okay, autism is not a spiritual attack. It's a well-known scientific condition, okay, that has something to do with the genes. Okay, so it's not spiritual attack. And for those that have tried to address autism spiritually, going to prayer houses, doing spiritual rituals and the rest of them, the issues remain. If it's a spiritual attack, with those spiritual rituals and the rest of them, is supposed to resolve. But the issues remain until the right intervention is started. So autism is not a spiritual attack. Autism has nothing to do with over-pampering. Okay, that is another different
then the medications during
the okay. Autism has nothing to do with medications during pregnancy. Okay, some people, or recently the president of the US said something about paracetamol use in pregnancy as causing autism. Okay, but there's really no scientific evidence to prove that. Okay, some other people have also come up to say that some vaccines cause autism. Okay, people have also gone to do studies. Do these vaccines really cause autism? Do randomized controlled trials, and they found no link between those vaccines and autism. So there's no scientific evidence that the mother not taking some medications during pregnancy is going to cause autism. Not taking some medications, particularly folic acid during pregnancy, may cause developmental delays,
which we will talk about later,
and some issues with the development of the spine that we call neural-tube defects. Those ones are known, but no scientific evidence has linked routine medications to autism.
All right.
Rather, genetics has been linked to autism. Prematurity has been linked to autism.
Oh, okay.
Okay.
Okay. I thought you were going to continue. Thank you. Okay. As we wrap up, the month of April is usually marked more like Autism Month, and I know that a lot of families are watching, and parents want to know. Sometimes it's not always easy on the caregiver. Half the time they struggle a lot. And for some people who do not understand what this is about, they tend to throw what very insensitive statement around sometimes that can be very hurtful. I'd just like you to give us like a balance, some kind of encouragement to the caregivers, to people who don't understand what this is about, on how they can show love, kindness, and maybe how caregivers can also cope while they're caring for the needs of the autistic children.
Okay, for the caregivers, first and foremost, I would like to say it's not your fault. Okay, to you there, mama, it's not your fault. You've done nothing wrong for your child to be autistic. And your child is not disabled. Your child is just different. Okay, your child is a child just like every other child. Your child is capable of learning, capable of being loved, okay, capable of developing. Okay, there are well-known people that are autistic. Okay, like the famous Elon Musk, Bill Gates. They are rumored to be autistic. We don't know whether it's true, but there are rumors that they're autistic. So if they are really autistic and they're able to achieve what they achieved, so you, mama, your child can be able to achieve his full potential. All he needs is the right intervention, okay? Seek care early and you'll be directed to the appropriate ways to assess this intervention so that your child will get to their full potential. The dangers of delaying is that when the child delays and the brain matures to a certain point, those interventions no longer work as well as it would have worked if it was a younger child. So instead of self-blaming yourself, seek help early. Go to any pediatric hospital, any teaching hospital, ask for the pediatric section. Get your child assessed and the right help will be offered to your child.
Okay. And then the audience, I mean, people who are watching us who don't understand what this is about, I'd like you to give a word to them who sometimes just feel, this child, I'm talking about the insensitive remarks that people oftentimes throw around autism and autistic people. So more like a word of how they can show more love and kindness.
Yeah, the child with autism is just like every other child. It's not their fault. It's just a human being just like all of us, okay? So there's no need shaming them. There's no need shaming their parents. There's no need shaming their family because somebody in your family may tomorrow develop that challenge. So show some love, support the next mother who is dealing with that child with autism and special needs. Support them. Don't blame them. They're already blaming themselves already. So show them more love. Be more compassionate towards them.
All right. Thank you so much, Dr. Ngozi Onu. It's been, I mean, I wish we could go on, but then again, we'll see you the other part. It's been Dr. Ngozi Onu, Pediatric Neurologist, Enugu State University Teaching Hospital, talking to us about Autism Spectrum Disorder. It's been quite an eye-opening session. I learned so much. By the way, this will be up on our YouTube channel, Afia Culture and Lifestyle. If you get to miss it on Wednesday, of course, 6 p.m., thank you so much for being a part of the show. My name is Doris Mayim Shishe. Have a lovely evening.